Families. So, moment of transparency. If you haven't noticed from my last few videos, I have like social anxiety and I'm like afraid of being in front of the camera. I've just been in my own little shell. I haven't had any social media for about over 5 years now. So just really putting myself out there and subjecting myself to just different kind of energies and people. It's just a different experience for me. But I feel like this information is way more important than my fear. And also by me doing these videos and continuing to do them, I'm able to get over that fear. So here we go. So to give some context, I'm an active member of several nonprofit foundations that provides free doula services for Black women throughout the Los Angeles, Orange County area. So I've supported women who were victims of domestic violence and living in shelter, women who were victims of sex trafficking, women who are on Section 8. What I noticed in between all of those women is that they don't have the pertinent information when it comes to hospital interventions, newborn procedures, and also the options that they have outside of that. I feel like a lot of the time, a lot of moms are coerced into making decisions that they don't want to. So I feel like this is a really great topic, not only for all women, but especially my Black women out there. I don't have to really go over all of the scary statistics, but it's really just time to take that power back and just to know all of your options so you aren't put through a hospital mill with everyone else, because your birth is more important than meeting quotas in a hospital. My name is Christian. I'm a certified birth doula, aromatherapist, and herbalist here in the Orange County area. And if you want to learn about all things birth, pregnancy, postpartum, and essential oils, go ahead and click that subscribe button and hit the little notification bell to be notified of all of my newest videos. So the first half of the video, I'm going to be going over possible hospital interventions, and the second half of the video are going to be going over the newborn procedures. I'm going to be giving you the pros and cons of each and also your options. Also, if you see the camera going in and out, it's really gloomy outside today, so you might get like different lightings throughout the video. The first hospital intervention I'm going to be talking about are IV fluids during labor. So when you're given fluids via IV, it's a catheter that's put inside either your hand or the inside of your arm. It's basically a continuous strip of fluids, more specifically saline. There are 3 types of IV solutions that are typically used. I'm going to list them right here. As mentioned in my previous videos, labor is equated to a marathon. And when you're actually hydrated, it can actually shorten your labor by 30 minutes. And if you are dehydrated, it can prolong your labor up to an hour and a half longer. So receiving an IV is just a sure way of the hospital knowing that you are properly hydrated during your labor process. So there are some pros to receiving an IV. One, that is a surefire way of knowing that you're properly hydrated. And also it'll be easier for the hospital to administer any kind of additional medication such as Pitocin. A few of the cons would be just the placement of where they put the IV. It can be a little bit uncomfortable. I've seen bruises. It really sort of messes with your mobility, and just you being comfortable is of the utmost importance when it comes to that. The next con can be overhydration. Being when you're administering fluids orally, it has to go through your intestines and everything before getting to your blood. When you get an IV, it's putting the fluids directly into your bloodstream. So overhydration can happen, and especially if it's administered too early, it can make your hands and your feet swollen, and it can engorge your breast, which can affect breastfeeding initiation when your baby's born. And the last con would be your bladder faces severe stress during those next few days of postpartum. Your bladder is going to be working really hard to excrete all of those extra fluids that were inside of your body. So that's just one more thing that you're going to have to be dealing with during that postpartum time. Over 85% of women giving birth in a hospital will receive an IV. There's been several studies done that show that there was actually no difference in between women who received an IV or women who chose to drink only water. There was no difference in length as far as labor or any kind of progression issues. So every time I'm supporting anyone, I'm always on top of their water intake and their food intake. I've seen several firsthand accounts of moms not being hydrated and it prolonging prolonging your labor. Drinking anything from water, I like to recommend coconut water, ginger ale, even a little soda pop just to give you that sugar kick. Any kind of hydration is really key to this process. If you don't want to receive an IV and just want to stay on top of your eating and drinking, that's going to be something that you're going to have to communicate with your doctor. The times where I've seen it medically necessary, if mom was really just not drinking any water at all, or if she's throwing up profusely and she's not regaining that hydration inside of her body. So you always just want to keep a clear communication between you and your doctor. The next intervention that I'm going to be going over is an amniotomy, aka doctors artificially breaking your water. Only about 10% of women are going to experience a spontaneous rupture of her water, but for the most part, it's most commonly a trickle. When receiving an amniotomy, it's used to either help start labor or to get labor progressing, though its effectiveness is not 100%. More recent studies have shown that receiving an amniotomy just by itself had no effectiveness as far as shortening labor or having labor progress if it's your first child. You see the most progression when they start with the amniotomy, then they have to give you Pitocin, and then all of these different interventions. So really an amniotomy is like the first of a whole cascade of interventions. And the women who usually get all of these interventions do have their baby within 24 hours. Some of the pros for an amniotomy is that it can progress labor, again with all of the other augmentations as well. Another pro is when your water does break, the doctors are able to observe your fluid and to make sure that it's either running a clear or a yellowish color, just to make sure that there isn't any meconium inside of there. An amniotomy is also a safer, or really just a drug-free version of induction. There are so many other things that you can do that can help labor progress, such as movement, eating and drinking, labor position. Some of the cons are you are at a slightly higher risk of getting an infection, just because when your water that's inside of the sac is there to protect baby from any harmful bacteria, viruses, or anything like that. So when you take away that protective layer, every time the doctor is doing a cervical exam or introducing any kind of foreign object into your cervix area, you are at a greater risk of infection. Another con can be just a failure to start labor. Again, having an amniotomy by itself, it has shown to not shorten labor or to help your labor progress, especially if this is your first child. So labor might not begin when you have an amniotomy. Even when women's water breaks spontaneously, your body can't wait to go into labor like a week or so. So it doesn't necessarily mean that you're going to go into labor right then and there. It's just another sign that your body is preparing for labor. Other cons can be, depending on the station of your baby, cord prolapse can be another con, and also fetal distress. When you're using all these different interventions, it's not only stress your body out, but it can also stress your baby out. And having a stressed baby is the last thing that we really want in this situation. While we're on this subject, the next intervention that I'm going to be reviewing are cervical exams. So a cervical exam, just to give you a little background, is when the doctor puts their hand up your vaginal area, use their fingers to check how many centimeters you're dilated and the effacement. Receiving a cervical exam can be very uncomfortable and cause some bleeding. In more recent studies, like the Cochrane review, the jury is still out on whether cervical exams are reliable or really just acceptable as far as gauging how labor is progressing. Some of the cons for cervical exams are, especially if your water is already broken, you are at a higher risk of infection. Next is sometimes those tests aren't even accurate, all subjective to the doctor that you have. The next con is every time that you get these cervical exams, it sort of takes you out of that labor mind, that instinctual just space that you are, and it puts you back at your rational brain. It really disrupts your whole laboring process. And I've seen cervical exams, and especially depending on what part of labor that you're in, every time they check, you're susceptible to being disappointed, because it's like you've gone through all of this, and to find out if you're only 2 or 3 centimeters, it can really throw your whole emotional well-being off, and that's the last thing that we need during this process. Your body knows what it's doing, and your body is not on man's time. Your body is on baby time. The next intervention I'm going to be talking to you about is continuous external fetal monitoring. So when it comes to EFM, there are several different kinds. The first is continuous, the second is intermittent, and the third is just having a whole hands-on approach and using a handheld Doppler. Studies have shown, in comparison between the groups, that the group with the continuous EFM actually had a 63% higher chance of receiving a cesarean section and a 15% more likelihood of needing some kind of assistance during the extraction phase, so whether it be the vacuum or forceps. And also the handheld devices seem to be more reliable than the continuous EFM. Non-ionizing radiation is still radiation that you're exposing yourself and your baby to, especially for that long period of time. If you and baby are healthy and you're not high risk at all, you can opt for handheld Doppler and have a doctor just come in. I believe it'll be once every hour, once every 2 hours to check with their handheld device. One of the things that you do have to think about if you're receiving continuous EFM is that it can restrict your movement. Those sensors on those belts are very sensitive, and any kind of movement really set those alarms off, and the nurse is going to have to keep coming back to fix them. I've even seen it to where nurses have laboring women not to move at all. Like, movement is the #1 thing that you need for this process, so it can mess with your movement. Also, continuous EFM, it can really take the focus off of mom and really puts the focus on these machines. It really just mess with the psyche and just the whole birth space as a whole, and bring that constant. Yes, it is like great to hear it, but I mean, when you're there for hours and hours of hearing that, it sort of just disrupts your whole birthing space. Those sounds can really distract actually going on inside of her body, and it can lead to an increase of just pain awareness and remembering that you're there in labor. The next intervention that I'm going to be reviewing is an episiotomy. An episiotomy is a blunt cut that's made to your perineum, that space between your vaginal opening and your anus. The intent is to give baby more room when traveling down the vaginal canal. The pro is that it can prevent serious natural tear. Some cons will be, can actually put yourself more at risk for a 4th degree tear, and that's when the tear extends to your anus and can create fecal incontinence. A few of the other cons are you do have an increased risk of postpartum hemorrhage and infection. So you do have some options outside of an episiotomy. #1, it's always better to tear naturally, because if your body is the one that's tearing, your body in most cases knows how to repair itself as opposed to just a blunt cut. Second is, what you can do during that 3rd trimester, you can do perineum massages or warm compresses just to really get that skin more pliable and ready for baby to come through. If you want to learn more about perineum massages, go ahead and leave a comment below. But if you are in labor, you want to start getting your perineum prepared, you want to do it in that 2nd stage of labor and get a warm towel and start doing those compresses. The next hospital intervention I'm going to be talking to you about is an epidural. Receiving an epidural is a catheter that's put in your spine that'll either give you partial or total loss of sensation in the lower parts of your body. A few of the pros are, of course, you either have little to no pain during labor, and you're also still able to be present. Another pro is I've seen moms that were just really tired from labor, especially in those earlier stages, because you're not able to rest at all. So I've seen moms that were up for well over 24 hours. So having that epidural does allow a mom who's exhausted to really sleep and relax, because your body can't be exhausted when giving birth. Another pro is more medication can be administered easily so that you still get that continual pain relief. A few of the side effects will be, since you do have that loss of sensation in lower parts of your body, you will more than likely have to remain in bed during your labor, and we all know that movement is key. But there are still some labor positions that you can take advantage of if you do have an epidural. So it doesn't hinder your movement completely, but it definitely cuts it down. Another side effect is that you can suffer from any short-term or prolonged ligament or bruising in that area due to the catheter from the epidural. So you can experience some involuntary shaking or shivering. That usually happens when the medication is going into your bloodstream cold. So that can be fixed by either giving you a lower dose or having them warm the medication before they give it to you. Another side effect that could happen is due to you not having filling in that lower part of your body, retain your urine. So when you get an epidural, you're more than likely going to have to get a catheter. Another undesirable side effect could be it can actually slow down labor, which in turn causes you to need Pitocin. If you have to use Pitocin, you're 2 or 3 times more likely to need an emergency C-section. Now, there are some potential newborn risks, the first being an irregular heartbeat, which will require mom to either be on oxygen, position changes. Studies have shown that an irregular heartbeat is the second most common cause for having a cesarean. Another potential newborn risk is a decrease in infant responsiveness. I can give an example about me. My mom, when she had me, she received an epidural and she was so traumatized. She said when I was born, I sounded like a drugged up baby. Like I was barely crying. I just wasn't responding well. And after that situation, she's had my next 4 brothers totally unmedicated. So that is something that you want to keep in mind. Another unintended newborn risk could be a short-term subtle neurobehavior effects such as inconsolability, irritability, baby not being able to track moving objects, shut out noise, or even cut out bright lights. And possibly less efficient or less organized suckling, initiation of breastfeeding. Nurses have reported babies who had an epidural breastfeeding, it's more difficult for them as opposed to babies who were born with mom unmedicated. So yes, an epidural can help as far as pain management when it comes to labor, but especially if you and baby are healthy, you really want to weigh the pros and the cons of the situation and really decipher between pain and suffering. Now, if a mom goes in and she wants an epidural, I'm all for that. I'm all for what the mom wants, but I am also all for mom knowing all of the potential risks that come with that decision. The next hospital intervention I'm going to be discussing is Pitocin. So Pitocin is a synthetic form of oxytocin, which we naturally make inside of our body, and it's used to either help kickstart labor or to progress labor. And usually it's in a continuous drip, as opposed to oxytocin that's released into our body in pulses. Now, Pitocin is considered a high alert drug. So if you do get Pitocin, you're more than likely going to need a blood pressure cuff, the tube belt, we're gonna have to check you. Like, it's a lot of things that go with Pitocin and not just the medication. So with Pitocin, since it is a synthetic form, your contractions are gonna be more powerful, could be more inconsistent, and that can cause fetal distress, which is the last thing that you want in this process. Now, there are situations where Pitocin is medically needed, but if you're using Pitocin or if Pitocin is suggested to you just because you aren't progressing at the time that they want to, there's a lot of health risks that come with that. Some of the risks are your chances for a C-section actually triple. And also Pitocin causes longer and stronger contractions, and those longer and stronger artificial contractions can really deprive baby of blood and oxygen, and it can in turn cause fetal distress. Another risk is the physiological side of labor is hormonal. So when you're adding and introducing the synthetic hormone, it can interfere with the very delicate orchestration of mom's hormones and baby's hormones. In the US Pitocin package, it is painfully clear about the risk of this drug. So I'm just going to read some of the risks that they include inside of the packet. The first is fetal heart abnormalities, which is a slow heartbeat or arrhythmia. Next will be a low APGAR score. The next is neonatal jaundice, neonatal retinal hemorrhage, permanent central nervous system or brain damage, or fetal death. When presented with Pitocin, like I mentioned before, there might be situations where it's medically needed, but for the most part, if you're using it just to progress labor, you really want to weigh out the pros and cons of the situation. And there are so many other options that you can use outside of Pitocin, such as movement. Moving around and using gravity to help baby descent inside and really to help with dilation. That's one way that you can really help as far as progressing in labor, even if you have an epidural. I've had a situation to where I've actually had a few situations. One that's a mom is due in March, and she told me that when she went to her doctor's appointment, mind you, her due date is March 12th. But they informed her that if she doesn't go into labor by the 5th, that they were going to induce her, but because her baby was too big and they want to avoid a C-section. So I sent her some information as far as the pros and cons of Pitocin and what a big baby means, because first off, what they considered a big baby, not even accurate half the time. So I gave her all the information and she asked questions to her doctor, and then all of a sudden the next appointment they never brought up induction again. I've also had a situation where a mom, she received an epidural, and I literally heard the nurse inside of the hallway say, I want her to have this baby by the end of my shift. So I just kept that in the back of my mind and saw that they had presented her with the Pitocin option. I informed her of what the nurses said, because it's literally for no benefit for the mom or baby. It's just because she wants her to have the baby by the end of her shift. So it got to a point to where they were saying they're going to check in a few hours, and if she hasn't progressed, then they're going to talk about taking that route. So within that 2 hours, I was having her move around in the bed. We were doing affirmations, meditations. Next thing you know, she was dilated all the way to 10. Really want to take into account movement, and less interventions the better, because once you start, even an IV can lead to Pitocin, because an IV, it's easier for them to administer Pitocin, and then from Pitocin you're more than likely going to need an epidural because the contractions are artificially stronger and longer, and then after an epidural then you're more than likely going to need a C-section. So it's just like once you start one intervention, you're just gonna have to, it can start a whole cascade of other interventions. Especially if it's not medically necessary, it does more harm than it does benefiting you or your baby. The next intervention I'm going to be talking to you about are forceps and vacuum extractions. Now first, for the forceps extraction, they look like large spoons, like tongs. And then when you use either forceps or a vacuum, that's going to be called an assisted delivery. But with the forceps, the doctor must be specially trained to use these, because it takes great skill and technique in order to have successful forceps extraction. The use of forceps or a vacuum can be used if mom suffers from any kind of heart disease and she's medically not able to push anymore. Some of the pros of using forceps is that, of course, it can help the extraction of your baby. Also avoids you having to get a cesarean section. Also, using forceps lowers your risk of your baby having cephalohematoma as opposed to using the vacuum. There are a few risks when it comes to forceps. The first is you have an increased risk of causing facial nerve damage to your baby as opposed to the vacuum. The risk of retinal hemorrhage and cephalohematoma is lower when using the forceps as opposed to the vacuum. Another risk can be pelvic floor trauma. In 2020, there was a study done, and they showed that more women experience pelvic floor trauma when needing an assisted delivery when using the forceps as opposed to the vacuum. Now for vacuum extraction, it's the same thing as far as an assisted delivery, but with the vacuum extraction, it uses a small suction on top of baby's head to really help guide baby out of the vaginal canal. Vacuum extraction is packaged as a less risky form as opposed to using the forceps for mom and baby. Yes, vacuum extraction is less risky, but they also have a higher failure rate. And if the vacuum fails, then you're more than likely going to need a cesarean section. And with a cesarean section, you're also increasing your risk of other various complications. With a vacuum, you are at a greater risk of baby having a cephalohematoma or retinal hemorrhage. Another risk can be jaundice, and that's when baby's skin and eyes are yellowish. Even though it is rare, intracranial hemorrhaging is another risk. That's when baby is bleeding inside of your skull, and that can affect baby's speech and memory. So some helpful questions that you can ask so you can gauge the kind of doctor that you're dealing with would be, what are some ways that we can reduce the need for forceps or vacuum extraction? Another would be, at what point might you use forceps or vacuum as an extraction route? And another would be, do you typically use forceps or the vacuum, or vice versa? The next intervention that I'm going to be discussing with you is cesarean section. Cesarean section is major surgery. That's when the doctor cuts open your abdomen and your uterus and gets your baby out. Cesarean section can be life-saving, but if you're eligible for vaginal birth, doctors recommend vaginal birth as opposed to a cesarean section. Some of the pros for cesarean section is that it can be life-saving in some situations, be more planned as opposed to a vaginal birth. And also women who have a C-section, they're less likely to suffer from any kind of urinal incontinence. Some of the cons for a cesarean section is that your recovery time is going to be way longer. Your hospital stay, as opposed to one having a vaginal birth, which is typically 1 to 2 days, you have a cesarean section, it's going to be more like 2 to 4 days. Also, you're recovering from major surgery, so the incision site and everything needs to heal back up, which takes about 2 months. With the incision, it can be more painful, just not comfortable at all, especially during those postpartum times when you're trying to hold your baby, feed your baby. That incision site can get very irritated and you have a higher possibility for getting an infection. With the cesarean section, you are at an increased risk of blood loss. Also, women are 3 times more likely to die during a cesarean section as opposed to a vaginal birth, just due to various things, a mixture of blood clots, any kind of complications. So that's what goes into that risk. Once you have 1 C-section, you're more than likely going to need a C-section for any future pregnancies. And babies born via C-section typically have more breathing problems, more latching problems. So again, that's something that you're going to want to take into account. Also, there is a small risk that baby can get nicked with the scalpel. In 2020, there was a study with 33,000 women that showed the connection between babies who were born via cesarean and them later developing diabetes or being obese. If you are in a situation to where you need a cesarean section, there are different things that you can ask for your birth, such as a gentle cesarean. That's where your family can be in there. Also, you can still opt for immediate skin to skin. There's still a few things that you can do even if you do have to go that route. So some really helpful phrases when it comes to decision making, if any of these hospital interventions are presented in front of you, would be, I'm looking to take things slowly. What are my alternatives? Another helpful phrase is, if me and my baby are healthy, I'm not looking for any alternatives right now. Is this an emergency? I would like to get a second opinion, all the way down to just straight up no. So feel free to use these options because I've seen it to where it's just like that awkward stare down, like make a decision now. But no, you have time, especially if it's not an emergency, you have time to do your own research and to get second opinions. If you're liking this video, please give me a thumbs up. That helps with my channel, especially since I'm new. So it doesn't cost you anything. So for the second half of this video, I'm going to be going over with you the typical hospital newborn procedures and the options that you have. The first is actually catching your baby and then proceeding with immediate skin to skin. My personal birth philosophy is I just don't believe that a stranger, aka the doctor, should be the first one to really touch and hold your baby after you've been the one that's doing all the work. So if it is an option for either you or your partner to catch your baby and then putting your baby on your chest for immediate skin to skin, that's always a really good option. Immediate skin to skin has been scientifically proven to benefit both mom and baby. So some pros for the mom is delivery of the placenta is easier. There is an increase in breastfeeding efficiency. With that skin to skin, you are lessening your risk of postpartum hemorrhage. And also with that is skin to skin, mom's oxytocin level is really high at birth, and that's related to establishing that mother and baby bonding. Pros for baby are, baby is able to initiate breastfeeding. Having that skin to skin also helps regulate baby's body temperature because obviously it's different from being inside of your body to the outside. So having that skin to skin really helps baby adjust to the outside world. So especially in that first 30 minutes after birth, newborn baby has the highest level of catecholamine, which is a neurohormone. And that neurohormone helps strengthen baby's memory, learning, and also helps with the ventilation in the baby's lungs. And studies have also shown that babies cry less when given that immediate skin to skin. The next procedure I'm going to be talking about is using this suction bulb for your baby at birth. Now, a lot of us have seen the doctors after baby is born, they suction the nose and the mouth. And that's actually a very outdated practice. And the WHO recommends that if baby is healthy, crying, born with clear fluids, it's actually more beneficial for them to wipe the fluids. When they use that suction bulb, Sometimes those nurses can be very aggressive and they can scrape the back of your baby's newborn throat. If they go too deep, they can actually cause nerve damage in your baby just because your baby is so delicate at that time. So you always just want to be mindful of them doing that, or you can even just say that you don't want that done. That's one of the options that you do have. The study that I'm going to attach in the description bar shows that there's no difference in breathing when either wiping or suctioning a baby. The next newborn procedure that I'm going to be talking about is delayed cord clamping. So when newborn babies are born, they of course have their lifeline that hooks them up to mom. And in that umbilical cord for the whole 9 months that they were baking, baby was given oxygen, blood, any stem cells, everything that the baby needs. It makes the umbilical cord makes that happen for the most part. So when baby is born, about 1/3 of baby's blood is still inside of your placenta. That's vital because that's the same amount of blood that it takes for your baby's lungs, kidneys, and liver. So when they're clamping that umbilical cord, they're basically cutting off the baby's blood and oxygen and stem cells that the baby would have received. So by doing that delayed cord clamping, you're making sure your baby gets that 1/3 of blood that's inside of you. Your baby's getting all the vital stem cells, and stem cells play an essential role when it comes to immunity and just development as a whole. When you ask for delayed cord clamping, just know when a hospital agrees to that, they're going to go by the textbook. And the textbook is 20 seconds to a minute. And you really want to do the delayed cord clamping until the cord runs white and stops pulsating. That's how you know that the blood is done transferring to baby. So yeah, don't do that textbook stuff. Tell them that you want it until it turns white or until it's done pulsating. Next is your placenta. The street value of your placenta is about $50,000. If you don't plan on doing things like placenta encapsulation, which I do recommend that you at least look into, there are a lot of great benefits if your placenta is in a healthy state. Your placenta is sold to the hospital, and a lot of the times they don't disclose what they do. Hospitals that do, from biotechnology companies down to cosmetology companies. Like one company in particular makes $10 million just from the storage and use of placentas and the cord blood. The women do not receive any kind of recognition or any kind of compensation if their stem cells were used in any kind of treatment or cure. And those are developed from their own bodies. So if you haven't heard of placenta encapsulation, it really helps with regulating your hormones, especially during that postpartum time when your hormones are so volatile. Next is it also helps replenish your iron in your blood, helps with postpartum hemorrhage, it helps with your breast milk supply, and it also helps with postpartum depression. Next is going to be the vernix caseosa. The vernix caseosa is that white, and it can sometimes be like a cheesy texture substance that covers your baby when they're born. The amount of the vernix decreases the closer the baby gets to term. Coating that you do see is antimicrobial, anti-inflammatory, then antibacterial, and it really helps to protect baby's skin while they're on this outside world. Also, the vernix can help regulate baby's body temperature when outside of the womb. And when baby is inside, baby swallows that vernix, and that vernix contains more than 20 amino acids, which really helps support baby's gut development. The only con is, depending on how much vernix your baby has, is that it's not attractive, but your baby isn't born dirty. Your baby is probably the most cleanest thing in that hospital. Even delaying your baby's first bath 24 to 48 hours, I really do recommend about a week later. Like I said, your baby isn't dirty, your baby isn't doing any kind of strenuous work or anything like that. So the next newborn procedure I'm going to talk about is erythromycin. If you don't test positive for gonorrhea or chlamydia, erythromycin is not necessary. And even the silver nitrate that's deemed safe isn't safe at all. The erythromycin can also disrupt the baby gaze and that baby bonding time, especially when you're in that golden hour. Erythromycin also has a 20% failure rate, also cause chemical pink eye, vision problems, and just even eye pain. It's even recommended during those times that actually the colostrum in your breast milk is better for your baby than the chemical. Next is going to be the vitamin K shot. So first, I just wanted to mention that vitamin K is not a vaccine. It's just a shot. And I'm going to list all the ingredients down here. So babies, when they're newborn, they aren't able to produce any vitamin K, which helps with the blood coagulating. And when baby is being born, some babies can be born with bruises and even worse, internal bleeding just from traveling through the bones in the birth canal. So the hospital will give the baby a vitamin K shot so your baby's blood can coagulate if they have any internal bleeding. So you have several options outside of just giving your baby the vitamin K shot. This would be, actually the hospitals carry the synthetic form just because it's cheaper. You can ask for either the natural form or the preservative-free form. If you don't want to give your baby the shot, you can actually take the shot and the baby will get the vitamin K through your breast milk. Or if you don't want to do that, you're also able to give your baby the vitamin K orally, which would be about once a week. Studies in Denmark have shown that giving baby the oral version of vitamin K is just as effective as the shot. I just don't believe in giving your newborn baby a shot, especially if there are just so many different avenues that you can take. I'm going to be talking about the Hep B vaccine. I'll list the hepatitis B ingredients right here below. So when it comes to the hepatitis B, if you or your partner aren't positive, or anyone in your house or anyone else in your house positive, your baby is not sexually active, are able to delay the hepatitis up until they go to school when their immune system is a little bit more developed. The recommended dose for the hepatitis B is the same for a newborn baby and a 19-year-old. So that's something that you also want to keep in mind. At the end of the day, exposing yourself and your baby to excessive stress can actually have a detrimental effect on not only you, but your baby's health. It can also lead to stress-related health issues in the future. Some studies even suggest that babies that are exposed to long-term stress can have issues with their brain growth, development, and in extreme cases, shorten your baby's life. So if you and your baby are healthy, you really want to weigh the pros and the cons in this situation and really assess if the hospital is presenting you these things as a convenience for them or if it really is for the health of you and your baby. They legally have to let you know all of the risks that are associated with any kind of augmentation or intervention at all. So it's always useful to hire a doula, just because your doula is able to support you in the times and help keep you look at the end of the tunnel. The hospital is going to be coming to you with a lot of things and you are like not in the emotional state to be making any kind of change. Sometimes the way the hospital packages things is in this pretty little bow when it's the opposite. Always just want to weigh out your pros and your cons. I hope this gave you some more clarity as far as hospital interventions, newborn procedures, and I hope that I really opened your eyes to the options that you do have. This is your body, this is your baby, this is your birthing experience, and I really want women all around to really take that power back because our bodies know what to do. Birth is a natural and sacred occurrence. It's really a sacred journey. If you have any questions about any of the interventions that I mentioned or any of the newborn procedures, leave them in the comments below or send me a message. I'd love to hear you guys' feedback. Thank you guys so much for watching my video. If you haven't already, go ahead and hit that subscribe button. Have a good day. Bye.